My name's Michael Reynolds, Worragiri physiotherapist and university academic. I'm representing Indigenous Allied Health Australia on the Australian Standards for Health Practitioner Pain Management Education Governance Advisory Group. When we talk about appropriate care for Aboriginal and Torres Strait Islander people, we're talking about culturally safe care. Care that is safe for people to access, but also can help them thrive in their health outcomes to be the best versions of themselves that they can be. The great strength and value for Aboriginal and Torres Strait Islander people, when we do that with communities, and I'd say if we do this for anyone, any Australian, but particularly for Aboriginal and Torres Strait Islander people, if we include their culture, their mindset, their beliefs around pain, then we're getting the most, not just out of them, but through their families and communities, and really uplifting everything that they're connected to, particularly when it comes to pain. Sometimes when people think about Aboriginal and Torres Strait Islander people, people consider them really just as one people. Not only are they two distinct Indigenous peoples of Australia, there's a great diversity within Aboriginal and Torres Strait Islander peoples in this country. In fact, there's over 250 different language groups and around 600 different dialects that were spoken here in Australia. That has a really big impact when it comes to how people practice culture and their practicing of healthcare in Aboriginal and Torres Strait Islander communities. So when we're looking at delivering pain management education, we need to have consideration for the great diversity in Aboriginal and Torres Strait Islander peoples in this country. The context of pain management may be very different in urban environments to rural and remote environments. It may be different to the north of Australian Larrakia country to the south of the country in Ghana country. It's going to be really different in different contexts, and when health practitioners are delivering pain management, they need to recognise the context in which they're working, the communities in which they're working with, and the people who they're working with. Unfortunately, it's still a fact today that around 20% of Aboriginal and Torres Strait Islander people experience racial discrimination at the hands of a healthcare practitioner in the previous 12 months. That's based on Australian Institute of Health and Welfare data in 2022. We need to make sure that we stop and think. I don't think anyone comes into health professions thinking that they're racist. No one walks through a door and thinks that I'm a racist health practitioner. No one thinks that. But it's often these unconscious biases that really get us unstuck or get us stuck. So we need to make sure that we stop and reflect on those biases, understand the historical determinants of health, the social determinants of health. Try to put a strength-based lens onto this. When we're thinking about Aboriginal and Torres Strait Islander people, there's often a deficit lens that's being put on many of our patients, including disproportionately Aboriginal and Torres Strait Islander patients. We need to switch that narrative, and that happens first in our heads. Not someone telling us what to do or telling us what to think. We have to think for ourselves. We need to think, do I have biases in relation to this? Do I need to stop and listen and actually see the best in this person rather than whatever I think is the worst in them? When we think about what health practitioners could do better with regards to Aboriginal and Torres Strait Islander people, I think the first step that people can do is to listen. And listen and recognise that although the experience that you've gained as part of your pain management education is really valuable, it's really only half the story. Because if we're serious about patient-centred care, community-centred care, which empowers people to be better and get out of this pain rut, then we need to come with a sense of humility. You might have heard this called cultural humility. And cultural humility with regards to Aboriginal and Torres Strait Islander people suggests that you don't know everything about the person in front of you. And if you're watching this, you might recognise that this doesn't just pertain to Aboriginal and Torres Strait Islander people. It's for everyone that seeks your services. So it's important when you're going into your patient interactions that you listen and you learn from the patient, because they are the masters of their own destiny. And if you understand what that is, then you can really unlock the potential within that patient rather than have them only being half served by your services. As a Worragiri man, physiotherapist, academic and representative for Indigenous Allied Health Australia, I've been incredibly thankful for the way in which these standards were developed. It was guided by a group called the Australian Standards for Health Practitioner Pain Management Education Governance Advisory Group, a group of really special individuals that encapsulate the breadth and scope of pain management and pain management education in this country. There was great consideration given to all cultures, but in particular for Aboriginal and Torres Strait Islander peoples, with wide consultation that occurred, both targeted and broader consultation to allow community to have a say. I'm really glad where these standards have landed, and I really hope that the implementation of these standards is done just as well.